Oh no, Pokemon needs to wait. Hello? 911? Yes, my 197-year-old grandmother just fell down the stairs.
Scene safe BSI. The mechanism of injury is that she fell down a flight of stairs. I confirm that she's my only patient, and I'm going to request additional resources. I'm going to have my partner hold C-spine. My general impression is that she's a high priority rapid transport, so I'm going to assess her alertness. So she's obviously not alert. Ma'am, she's not alert to verbal stimulation, so I would use the sternal rub for painful stimulation, and I'm not getting any response from that either, so she's unresponsive. I am going to now, her chief complaint is that she's an unresponsive elderly woman that fell down a flight of stairs, and I am now going to open the airway using a modified jaw thrust, and I'm going to assess to make sure if it's patent. If the airway is not patent, I'm going to suction, and then I'm going to insert an OPA. I would do it by going against anatomical position, and then once I face resistance, I would turn and put it into I would twist it and put it into the anatomical position. And if she gags, throws up, I would remove it and insert an NPA. So I'm going to assess breathing. I'm going to look, listen, and feel for chest rise, any breathing, and she's not breathing. So I'm going to have my partner BVM her. They're going to give her breath every 10 to 12 seconds, and we're going to hook her up to 15 liters of high flow oxygen. I'm then going to check for pulses on both the carotid and the radial pulse, and they're weak, rapid, and thready. And I'm going to check for skin color, temperature, and condition. And she is cool, clammy, and she has a delayed capillary refill. And then I'm going to examine the body for any major gross bleedings. I don't see any, and I don't see any major life threats. I'm going to assess the small of the back for any bleeding, and I don't note any, so I'm going to initiate shock treatment. And I am going to cover her up with a blanket. She's already in the supine position, and we're already giving her high flow oxygen through the BVM, so that does it for us. I am going, her GCS score is a 3 because she has a 1 for eye opening, 1 for verbal, and 1 for motor response, so she's the worst GCS score possible. So she's a high priority rapid transport, and I'm going to have my patient obtain some baseline vitals. So I'm going to now start my head to toe assessment, my rapid assessment. I'm going to palpate the head, the back of the head, the front, the facial bones. I'm looking for DCAP BTLS, which is deformities, contusions, abrasions, penetrations, burns, lacerations, tenderness, swelling. I'm going to check around the eyes, nose, mouth, and ears for cerebrospinal fluid or blood. And I'm going to take my pen light and I'm going to open up the eyes and I'm going to check for pearl. I am going to feel the back of the neck for any step-offs. I don't feel any. I'm checking for tracheal deviation in jugular vein distension. I don't notice either. At this point, I would expose the patient and I would check the collarbones for their stability, and they seem stable. So my partner is going to appropriately size and apply AC collar. I am going to walk the sternum, and then I'm going to walk the edge of the ribs, and then I am going to do 3 chest sweeps, and I'm still checking for DCAP BTLS at this point. And I would auscultate, so I listen here, 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 and here, here. I would listen to her lung sounds, and then I would palpate the 4 abdominal quadrants, 1, 2, 3, 4, and then I would assess the stability of the pelvis by going up and in, and then I would, she's a female, so I don't have to check the genitalia for priapism, but if she was a male, I would. And then I would check DCAP BTLS pulse, DCAP BTLS pulse, and then a DCAP BTLS pulse, DCAP BTLS pulse. And at this point, I would have my partner, they'd be getting a longboard for me, and I would then be ready to position her onto a longboard. So I would move her, and then I would lift her up onto her back like this. So 3, 2, 1, on the count of C-spine, obviously, and I'd keep her in line as possible, and I'd feel underneath the C-collar, and well, not underneath, but like below it, and I would feel for any step-offs, and then I would check for mud and blood on the back of her. And then I would put the longboard underneath her, and I would secure on the head of C-count, put her down. I would strap her in, I would secure her to the longboard, and then the longboard to the stretcher. And at this point, we would be getting into the ambulance and getting ready for transport. So since we took the blanket off her to do the head-to-toe assessment, I'm going to put it back because it's a treatment for shock. Now that we're in the ambulance, I'm going to reassess her every 5 minutes because she's a critical patient. We would go lights and sirens and we go to the closest trauma facility. And that's it.